Hello, I'm Dr. Chen, and what I'm about to share could transform how seniors deal with joint pain. After 15 years as a physical therapist specializing in geriatric care, I've discovered something remarkable. 3 specific pressure points in your feet that can provide almost immediate relief from joint pain throughout your body. I know it might sound too simple to be true. After all, how could pressing certain points on your feet possibly help with knee pain, hip discomfort, or arthritic shoulders? That's exactly what Margaret, one of my patients, thought when she first came to see me. At 72, she could barely walk due to severe knee and hip pain. She'd tried everything: painkillers, expensive treatments, even contemplated surgery. Her garden, once her pride and joy, had become overgrown because she couldn't bend down to tend to her beloved plants. What happened next surprised even me. After I showed Margaret these 3 specific foot points and taught her how to activate them properly, she experienced significant relief within just days. 2 weeks later, she walked into my clinic with a bright smile and a basket of fresh tomatoes from her garden, something she thought she'd never be able to do again. Now, you might be wondering, as I initially did during my advanced studies in therapeutic reflexology, how can this possibly work? As a Western-trained practitioner, I was skeptical at first, but after seeing hundreds of patients achieve remarkable results and diving deep into the research on neural pathways and pain response, I became convinced of its effectiveness. Before we dive into the science and I show you exactly how to locate and activate these 3 powerful points, comment below where in the world you're watching from. I'd love to know how far this pain relief technique might reach. You see, what makes these points so special is their direct connection to specific neural pathways that influence inflammation and pain perception throughout your body. It's fascinating how our bodies are interconnected in ways modern medicine is only beginning to understand fully. Let me share what happened with Bob, another patient who really opened my eyes to the power of these pressure points. Bob was 68, a former construction worker who loved playing with his grandchildren. But severe joint pain had reduced him to watching from the sidelines. He couldn't even pick up his youngest granddaughter anymore, something that broke his heart. When I first mentioned foot pressure points, Bob laughed. "Doc, I've got pain in my shoulders and knees. My feet are just fine." But here's what makes this technique so remarkable. These points work because they're connected to what we call neural pathways, like tiny highways that run throughout your body. When we activate these specific points, it's like opening up traffic lanes that were previously jammed with pain signals. The first point, located at the ball of your foot, has a direct connection to your hip joint. Think of it as a master switch that can help calm down pain signals coming from your hip area. The second point, found in the middle of your arch, relates specifically to knee pain. And the third point, near your heel, is what I call the inflammation master key. It helps reduce overall joint inflammation throughout your body. What's particularly exciting about this approach is that it's completely natural. You're not putting any chemicals into your body. Instead, you're working with your body's own pain relief mechanisms. It's similar to how acupuncture works, but without any needles, and you can do it yourself at home. After just 1 week of using these pressure points, Bob could lift his granddaughter again. By week 3, he was back to his favorite activity, getting down on the floor to build block towers with the kids. What moved me most was when he said, "Dr. Chen, I didn't just get my mobility back, I got my life back." The science behind this technique is fascinating. Modern research has shown that our feet contain over 7,000 nerve endings, each connecting to different parts of our body. When we strategically stimulate these points, it triggers the release of natural pain-relieving compounds and improves circulation to affected areas. It's like having a pharmacy right in your feet. You just need to know which buttons to press. But before I show you exactly how to locate and activate these points, let me address something important. I've had many patients ask me, "Dr. Chen, if this is so effective, why isn't it more widely known?" The answer lies in our healthcare system's tendency to favor medication and surgical interventions over simpler traditional approaches. Yet, what's fascinating is that this foot pressure point technique combines ancient wisdom with modern scientific understanding. Take Lisa's case, for instance. She was a retired nurse who was understandably skeptical about anything that wasn't strictly conventional medicine. She came to me after her arthritis had forced her to quit her beloved walking group. "I've tried every anti-inflammatory drug out there," she told me. "Nothing seems to work anymore." What made Lisa's case particularly interesting was how quickly she responded to the technique. After I showed her the precise locations and the correct amount of pressure to apply, she noticed a difference that very evening. "It felt like someone had turned down the volume on my pain," she explained. The key to success lies in understanding that these aren't just random points on your feet. Each one corresponds to specific neural pathways that influence different aspects of joint health. When you activate the first point, located at the ball of your foot, you're actually stimulating an area that connects directly to your hip joint through what we call meridian channels. These channels, while once dismissed by Western medicine, are now being studied extensively for their role in pain management. The second point, in the arch of your foot, has a fascinating connection to knee function. Research has shown that this area contains a high concentration of nerve endings that communicate directly with the knee joint. When properly stimulated, it can help reduce inflammation and improve mobility. The third point, which I call the master point, is perhaps the most powerful. Located near the heel, it helps regulate overall inflammatory responses throughout your body. Think of it as a reset button for your joint pain. When you work with all 3 points together, you're essentially creating a symphony of pain relief throughout your body. James, another patient of mine, described it perfectly. After suffering from chronic knee pain that was severely limiting his daily activities, he was amazed by how such a simple technique could make such a dramatic difference. "It's like having a secret weapon against pain," he said. "I just wish I'd known about this years ago." Now, let me show you exactly how to activate these points effectively. The key is in the technique. It's not just about pressing randomly. Start with the first point at the ball of your foot, right beneath your big toe. Using your thumb, apply firm but gentle pressure in a circular motion. You should feel a slight tenderness, but never pain. Count to 60 while maintaining steady pressure. For the second point, move to the arch of your foot, about halfway between your heel and the ball. This point can be a bit more sensitive, so start gently. Again, use circular motions, but this time, imagine you're trying to create warmth in that spot. 60 seconds here as well. The third point, our master point, is located at the center of your heel. This one requires slightly firmer pressure. Think of it as pressing an elevator button. You want to be deliberate, but not forceful. Another 60 seconds here is ideal. I always recommend starting with your right foot, even if your pain is on the left side of your body. There's a fascinating reason for this. Our neural pathways often cross over, meaning stimulation on one side can affect the opposite side of the body. This is something I discovered while working with Ruth, an 83-year-old former dance instructor. Ruth's case was particularly memorable because she had severe arthritis in her left hip, but found the most relief when we focused on her right foot's pressure points. Within 3 weeks, she was back to teaching seated dance classes at her senior center. The joy in her eyes when she told me about leading her first class again. That's what makes this work so rewarding. Here's a crucial tip that many people miss. Timing matters. The best results come from doing this routine 3 times daily: morning, afternoon, and evening. But if you can only manage once, make it part of your bedtime routine. Your body does most of its healing while you sleep, so giving it this extra support at night can be particularly effective. Remember Margaret from earlier? She found that soaking her feet in warm water for 5 minutes before applying pressure made a significant difference. The warmth helps relax the tissues and makes the points more responsive. It's like preparing the soil before planting seeds. You'll get better results with proper preparation. And here's something fascinating I've observed over years of practice. Patients who combine this technique with gentle movement tend to see results faster. Even something as simple as ankle rotations or toe stretches before and after can enhance the benefits. Think of it as warming up your car before a long drive. Everything just works better. Now, I want to make sure you have all the key points to make this technique work effectively for you. First, remember that consistency is crucial. Just like Margaret, Bob, and Ruth discovered, doing these pressure points regularly, ideally 3 times daily, brings the best results. Don't get discouraged if you don't feel immediate relief. Some people, like Lisa, notice changes right away, while others might need a week or 2 of consistent practice. Let me emphasize something important. This technique isn't meant to replace your current medical treatment. Instead, think of it as a powerful tool in your pain management toolkit. Many of my patients find they need less medication over time, but always consult with your healthcare provider before making any changes to your prescribed treatments. Here's what makes this approach so valuable for seniors. It's gentle, non-invasive, and you can do it anywhere. Whether you're watching TV, reading a book, or just relaxing in your favorite chair, you can work these points. There's no special equipment needed, no complicated movements, and no risk of overexertion. The most successful patients like James make it part of their daily routine. He does his pressure points every morning with his coffee, again after lunch, and once more before bed. It's become as natural as brushing my teeth, he tells me. And that's exactly the approach I encourage. Make it a habit, just like any other part of your daily self-care routine. Remember those 3 key points: ball of the foot for hip pain, arch for knee pain, and heel for overall inflammation. 60 seconds each. Gentle but firm pressure. Circular motions. Start with warm feet for best results. And always listen to your body. If any point feels too tender, use lighter pressure. What continues to amaze me is how this simple technique has helped so many of my patients regain their independence. Like Ruth, who's back to teaching dance, or Margaret, tending her garden again, or Bob playing with his grandchildren. These are the moments that matter. These are the activities that make life rich and meaningful. And that's what this technique is really about, helping you return to the life you love. I've seen too many seniors resign themselves to living with pain, thinking it's just part of aging. But it doesn't have to be that way. These pressure points offer a simple, effective way to take control of your joint pain and improve your quality of life. As my patient Lisa now says, "I wish I'd known about this years ago, but I'm just grateful I know it now."